Okay, so good morning one and all to join here for this today's session on viral diagnosis. So the viral diagnosis will be a bit of the various component. Today we are going to mainly see about the viral diagnosis is mainly done by using microscopy. Okay, so now the today's session will be how the microscopy will be important for a diagnosis of a viral infections. Okay, so now we know already the viruses are effectively causing the disease in human. Okay, so how we can able to classify the viruses? Okay, we know the point already. So the classification of the viruses mainly by DNA virus and RNA virus. Okay, so this is mainly by this is mainly by the nucleic acid specificity. So once the nucleic acids are classified during this viral classification, first we can start with a DNA, then the other one will be the RNA. Okay, so in DNA we have a double stranded DNA and single stranded DNA. We have the two morphology of the DNA will be there. Yes, the second one will be the RNA. So RNA will be a single stranded classical and double stranded RNA. So now the classification of the viruses is mainly by the DNA and the RNA structure. Okay, so that point we know already. Okay, so if the person is infected with the viral infections, okay, either by the DNA group or by the RNA group, so we are going to diagnose specifically. This diagnosis is mainly based on we are collecting the samples. Okay, so the first one, the sample collection is very important. After the sample collection, we are going to demonstrate the viruses in the particular sample. We call it as a clinical samples are taken for demonstrating the viral agents. Okay, so sometimes we are collecting a lesion specific samples. Okay, the second one is the serum samples. Point, remember the lesion specific sample and the second one is a serum sample. Now what is the difference between this lesion specific and the serum sample? Very simple. Now we can take this current outbreak of this COVID-19 coronavirus. We are collecting a lesion specific sample. That means we are collecting the nasopharyngeal or the oropharyngeal sample. Directly we are collecting the virus from present in the particular host cell. We call it as a lesion specific. Okay, for example, in the case of influenza, again we are collecting the nasal swabs for the diagnostic purpose. Then coming to the rabies virus, we are collecting the corneal smears or the biopsy. Okay, or we are collecting the CSF sample will becomes under lesion specific samples. Okay, right. Now sometimes we are using the serum sample also for demonstrating this viral particle and also the antibody, mainly taken for a serological examinations. Okay, so not mainly for a microscopic studies. Okay, so microscopic studies means mainly we require the lesion specific samples are very important for a microscopic methodologies. So then only we can able to specifically demonstrate this morphology of the virus in the microscopic method. So mainly we are using a lesion specific samples are collected. Okay, so in the case of rotavirus, we are collecting a stool sample. In the case of rabies infection, we are collecting the corneal smears or the biopsy from the facial skin we are collecting. Then in the case of swine flu, we are collecting again nasopharyngeal sample like COVID-19. So the lesion specific samples are very important for the diagnosis of the viruses, mainly if we are using, yes, microscopic method for diagnostic purpose. Okay, right. So first we can move on to the microscopy will be used for diagnosis of the viruses. Okay, now what are all the advantages of this microscopic method? Yes, what are all the advantages of this microscopic method? Yes, we can able to visualize, yes, the microbial agent. Okay, we have to visualize the microbial agent in microscopy, number one. Yes, number two, during this visualization we can able to demonstrate and describe the morphology. Okay, first we are visualizing, the second one is morphology. Okay, yes, during the morphology we can able to assess the size and shape of the microbial agent. Okay, so first one, either the microbial agents are present or absent, we call it as just visualization from the clinical sample to be done. Okay, right. Number two, the morphology has to be assessed. During the morphological assessment we are doing the size and the shape assessment also to be done. Okay, so depends on the size and the shape, some viruses has to be demonstrated or identified specifically. So we are taking the advantage of the microscopy towards the viral diagnosis by the size and the shape morphological assessment to be done. Okay, now there is a one more advantage to be taken here. Because of the size and the shape will be demonstrated, right, accepted. Because of this particular reason, even we can able to count the number of viruses. Okay, we can able to count the number of viruses also in the microscopic method. Okay, so the viruses will be effectively counted, the number, exact number, by a microscopic method. Okay, so these are all the advantages of the microscopy. So first one we have to visualize, the second one we can demonstrate this morphology, and the third one during the morphological assessment we can do with the size and the shape assessment. Then the counting the number of viruses also to be done by doing a microscopic method. Okay, so this will be very important process to be remembered during the microscopic assessment. Okay, yes, so first microscopic method we are using for the viral diagnosis will be, yes, it's called as electron microscopy. Okay, so we are using electron microscopy for demonstrating the viruses. Okay, yes, for which we are collecting the sample. Yes, we have to use a staining. Okay, this will be described as negative staining because we are using the chemical for demonstrating the viruses, that is phosphotungstic acid. Okay, phosphotungstic acid. Then we are using osmium tetroxide or ruthenium tetroxide. Okay, so either osmium tetroxide or ruthenium tetroxide, but mostly we are using the first one, that is phosphotungstic acid. Okay, so we are using the phosphotungstic acid that will be staining the sample. After the staining of the sample, we are demonstrating the viruses under the electron microscopy. So during the microbial agent will be demonstrated by electron microscopy, very simple. For example, this is the microbial agent. Okay, so once we are using the electron, okay, in the microscopy, the electrons are just present in the surface of the microbial agent. Once it is present in the surface, we can able to demonstrate, or we can have the outline of only the morphology, that is the outline or the outer layer. Because the electrons are not taken into the cells, it is not going to bind specifically with the cell organelle. The internal structures may not be demonstrated by the electron microscopy. Only the outline or the outlayer of the microbial agents are to be demonstrated. Okay, that is the one advantage. At the same time, that will be taken as the limitation. We cannot able to demonstrate the internal structures by the electron microscopy. Okay, right. So once we are releasing the electrons in the microscope, that electrons are deposited in the surface, that will be giving the effective outline of the microbial agent to be demonstrated effectively with their morphology to be remembered. So morphology of the microbial agent is effectively demonstrated by the electron microscopy. Okay, right. Now, if the electrons are used, it will be get deposited. Once we are seeing in the microscopy, okay, in the eyepieces, we are demonstrating the structure, only the outline to be taken. So based on this outline or the morphology of the viruses to be taken here, so depends on the morphology, some of the viruses are demonstrated. Okay, the first one which is shown in the picture, you can see. Yes, if you are taking the morphology like this, this is called as a bullet shaped. Yes, a bullet shaped, nothing but a rabies virus. Okay, so bullet shaped is rabies virus. Then coming to the second picture, yes, this will be like a wheel with radiations. Yes, a wheel like, that is rotavirus. Okay, so the wheel like appearance or the spokes like appearance will be a rotavirus. Okay, good. Now coming to third one, virus will be demonstrated, yes, like a brick. Yes, which is called as a brick shaped. Yes, that is pox virus is called as a brick shaped. Okay, then the one more virus will be demonstrated. Okay, it's called as, yes, space vehicle or satellite shape. Space vehicle or satellite, that is adenovirus. Okay, so depends on the morphology and the structure, we can able to demonstrate the microbial agent, specifically the viruses. So bullet shaped, we call it as a rabies. The wheel shape, that is rotavirus. Brick shaped is the pox virus, and the space vehicle to remember is adenovirus. So depends on the morphology, we can effectively demonstrate and identify the viruses in electron microscopy. So now the first point to be remembered here, demonstration of the viruses from the clinical sample by electron microscope. Okay, right, the first point is okay. Now coming to the second point, yes, depends on the morphological assessment. Okay, we can able to measure the size of the virus also. Okay, the size of the virus also to be measured during the electron microscopy. You can see, so we are have measurement of this 100 nanometer, that is the diameter will be demonstrated. So it will be not a 100, it will be just a 50%. For example, it will be taken as either 50 or a 60, 50 to 60 nanometer, because this will be a 100. So here it is not that much length, so we call it as a 50 to 60. So now depends on the morphology outline, we can able to measure the size of the virus also in the electron microscopy. Okay. Number one, morphology, the structure. The second one is the size of the virus to be demonstrated. So depends on the size, how we can classify. Either virus will be the smaller one or virus will be the larger one. We can able to categorize the viruses mainly by electron microscopy, because the other methods are not suitable for demonstrating the size. Only the microscopic method can be used for demonstrating the size of the any microbial agent. In electron microscope especially we are doing about the viral size measurement. Okay, after the size we can say either it is a smaller or larger one. Okay, right. Now coming to the third point. Yes, here the viruses are specifically taking the dye, that is phosphotungstic acid. We can able to make the counting of viruses. Point, remember, we can make the counting also. So we are counting 1, 2, 3, 4 like this. We are making the counting of the viruses in the electron microscopy. Okay, that is called as a total viral counting. It's called as total viral counting. So the number of viruses in the microscopy we are counting into the numbers, we call it as a total number of viruses from the sample. Okay, now one important point to remember here, even all the number of viruses are not going to make the disease for the individual. That means it is not act as a virion or a virulent mechanism. Okay, for example, we are detecting 1,000 virus in the microscopy. Not all the 1,000 virus are responsible for the disease for the individual. Among these, only either 60% or 70% or maximum 90% of the viruses will be responsible for the disease, not 100%. So that's why the electron microscopy will be taken for counting the total number of viruses, but it may not going to differentiate either the virus will be present as a replicative number or it will be holding the virion or infectious component. We cannot able to differentiate by microscopy. Okay, so point to remember, what are the advantages to be taken in the electron microscopy? Number one, we can visualize the viruses depends on the morphology, bullet shaped, wheel, brick shaped and space vehicle like this. The second one, we can able to measure the size of the viruses to say either it is a smaller or larger. Number three, we are making the counting or the number has to be measured. Either the total number of the viruses will be counted here. During the counting, we cannot able to differentiate either this is a effective virion, that is nothing but infectious virus, or that is present just as a replicated virus. Okay, so that is the one limitation, but that is not very important for the clinical assessment. So we have to use the electron microscopy for counting, the size measurement and morphological deduction. Okay, right. Now coming to the second microscopic method will be used here is light microscopy. So we are collecting the sample. Yes, we are making a staining. Yes, we are using a two different type of staining. Number one, we are using a alkaline stains. The second one is fluorescent stains. Okay, so if you are using the alkaline stains, for example, we are using methylene blue. Okay, that is crystal violet. Okay, or a neutral red. Okay, so these are all the staining will be taken as the alkaline staining. Once we are applying these staining, we can demonstrate the virus in a light microscopy. Okay, if we are using the fluorescent stain, for example FITC, fluorescent isothiocyanate, we have to use a fluorescent microscopy. Okay, so now we are using the two microscopy next to the electron microscopy. One is called as a light microscopy, the second one is a fluorescent microscopy. Okay, very simple. So the light microscopy will be demonstrating the viruses. Okay, now we are collecting the sample. One advantage is to be taken here. What is the advantage? Here the sample will be collected, that will be holding the host cell. Inside the host cell the virus is present, because we know already the viruses are always intracellular in nature. Okay, point remember, it is a intracellular in nature. So we are demonstrating the viruses within the host cell. Because of the host cell will be holding the virus, we can stain both the structure, either virus and also the host cell, both will be receiving the color, either the alkaline staining or the fluorescent staining. So both the structures are receiving the color, by which we can able to demonstrate the viruses along with the host cell. Okay, so once we are performing the staining procedure here, the host cell is demonstrated. Within the host cell, the viral particles are demonstrated, that will be described as inclusion bodies. Okay, that will be described as inclusion bodies. Okay, the inclusion bodies are nothing but the host cell along with a viral particle we are demonstrating. Fine, remember. Okay, along with the host cell, the viruses will be demonstrated during the diagnostic procedure. We call it as inclusion bodies. Okay, the inclusion bodies are nothing but the viruses will be present as a intracellular in the host cell, that will be receiving the color, either alkaline staining or the fluorescent stain. We call it as inclusion bodies. Okay, these inclusion bodies are taken as a specific diagnosis for the viruses. Okay, for example, we are demonstrating the inclusions within the Purkinje cell. We call it as Negri bodies. So Negri bodies are specific diagnosis for a rabies viral infection. So rabies virus are effectively demonstrated by a Negri bodies. Okay, that point we know, right? Now coming to the second one, the cell will be holding the inclusion bodies here, and the cell size also will be enlarged. The cell enlargement, okay, along with the inclusions are present in the cell, it will give owl eye appearance. This is called as owl eye appearance of inclusion body, will be very classical for cytomegalovirus, because the virus itself is called as cytomegalo. That means it will be enlarging the host cell. The host cell size will be enlarged during the viral infection, so the virus is called as cytomegalovirus. Okay, so the owl eye appearance will be very classical for diagnostic of cytomegalovirus. Okay, so similarly we can use the same sample. Instead of a alkaline staining, we are using a fluorescent stains for demonstrating the viruses. We call it as inclusion bodies. Okay, so inclusion bodies are nothing but viruses are demonstrated within the host cell. Okay, by staining procedure we call it as inclusion bodies. Okay, right. Apart from this two example, what are the other example to be remember for inclusion body? That is HP bodies, that is Henderson Peterson bodies are present in molluscum contagiosum. Then Cowdery type A or type B bodies are present in some other viral infections. So now the Negri bodies are Aulai inclusions, HP bodies, Henderson-Peterson bodies, or Cowdery type A or type B bodies. These are all the inclusion bodies are used for a specific diagnosis of a viral infection. Okay, yes. So now to conclude, so the microscopic method which is suitable for the viruses, number 1, electron microscopy, number 2, light microscopy, number 3, a fluorescent microscopy. So what are the advantages of this microscopic method? Number 1, we can demonstrate the morphology, the size measurement to be done, we can able to count the number of virus, and we can demonstrate along with the host cell, we call it as inclusion bodies. Okay, these inclusion bodies are very classical for diagnosis of a viral infections. Okay, yes. So with that we are concluding the session. So thank you for your patient listening, and bye from Dr. Vasant. We meet you soon in one more the next class. Thank you. Bye bye. See you.